Welcome back, my students. Dr. Oogway here, and today I bring you the theory part of the fourth ventricle, and I will also tell you how to write this question in your university examinations. Clearly, this is the video third from the playlist of the fourth ventricle. Clearly, my previous two videos from this playlist are about the diagrams, how to draw the diagram of the floor of the fourth ventricle and the roof of the fourth ventricle. Clear? So let's begin this question. We will write the answer of this question in our university examination under these seven headings: introduction, floor, lateral boundaries, roof, communications, cavity with recesses and angles, then its clinical anatomy. So let's begin with introduction to the fourth ventricle. In introduction, we will write two statements. In introduction, we will write two statements. Now, first statement that we will write is it's a cavity. Cavity in hindbrain. Hindbrain. More precisely, rhombencephalon. Rhombencephalon. So, what is fourth ventricle? Fourth ventricle is a cavity that's present in hindbrain, more precisely rhombencephalon. Then we'll make a small diagram. How we will draw the diagram? Like this: first bulge, then second bulge, then a line like this, then a bulge like this, then another thing like this. Clearly, this structure, this bulge right here is pons, this bulge right here is medulla, and this circle like structure is cerebellum. Cerebellum. And in between these three structures we have fourth ventricle. So fourth ventricle is present between pons and medulla ventrally and cerebellum dorsally. Clearly, so another point that we will write, it's a tent shaped cavity. It's a tent shaped cavity. Clearly, so introduction to the fourth ventricle is complete. It is a cavity in hindbrain, more precisely rhombencephalon. Then we will draw this diagram and write about its boundaries: ventral boundaries, pons and medulla, and dorsally we have cerebellum. And we will also write it's the shape of the fourth ventricle. It's a tent shaped. Clearly, it is a tent shaped cavity. Clearly, now we will move on to the floor. So introduction to the fourth ventricle is clear. Now we'll move on to the floor. My previous two lectures, the first lecture of this playlist is about how to draw the diagram of the floor of the fourth ventricle. And the diagram is this. This is the floor of the fourth ventricle. Now we will name some structures in this diagram, some important structures. Clearly, this structure right here, this part right here, it's called as the gracile tubercle. This part right here, it's called cuneate tubercle. This part right here is called inferior cerebellar peduncle. Clear? This circle-like structure, it's called facial colliculus. Clearly, and this line right here, this is called dorsal median sulcus. Dorsal median sulcus. Dorsal median sulcus. What this dorsal median sulcus? Dorsal median sulcus divides the floor of the fourth ventricle. This is the floor of the fourth ventricle into two symmetric halves. So this part right here is the first symmetric half, and this part right here is the another symmetric half. Clearly, so we are clear about the dorsal median sulcus. Another line that we have here is called sulcus limitans. This line right here is sulcus limitans. Sulcus limitans divides one half of the floor. So this is the one half. So this is the other half. Clearly, so one half of the floor of the fourth ventricle is divided by sulcus limitans. Into median eminence. So this part right here is median eminence, and this part right here, this part and this part is the vestibular area. So we can say the sulcus limitans divides one half of the floor of the fourth ventricle into median eminence, median eminence, and vestibular area. Clear? After that, we will talk about the facial colliculus. This circle-like structure is facial colliculus. In facial colliculus, this is the facial colliculus. Deep to the facial colliculus, seventh nerve loops around this fifth nerve. This is the seventh nerve. There's the facial nerve. It loops around the nucleus of the fifth nerve, abducent nerve. Clearly, this is the facial nerve. Clearly, so we also talked about the facial colliculus. So we talked about dorsal median sulcus, we talked about sulcus limitans, we talked about facial colliculus. Another structure that's present in the floor of the fourth ventricle is this area right here. There is a structure right here, that shaded portion. It's called locus ceruleus. This locus ceruleus is blue in color. Clearly, it is blue in color. Why it is blue in color? Because of pigmented neurons. Clearly, which constitute substantia ferrugenia. Substantia ferrugenia. Clearly, they secrete non-adrenaline. They secrete non-adrenaline, which helps in paradoxical sleep. Paradoxical sleep. So, what you will write in floor of the fourth ventricle? Floor of the fourth ventricle. First, we will draw the diagram. We will draw the diagram that I have already showed you in the first video clearly. Then we will describe some structures. First, we will describe its dorsal median sulcus. Then we will describe sulcus limitans. Then we will describe facial colliculus. In facial colliculus, how seventh nerve loops around. It's a structure deep to which seventh nerve loops around the fifth nerve. Clearly. Then we will talk about this structure right here. That's called locus ceruleus. Clearly, we'll talk about another structure that's called area proxima. This structure right here, it's called as the vagal trigone. This structure right here is vagal trigone. Clearly, between the vagal trigone and gracile tubercle, vagal trigone and gracile tubercle, there is a structure right here that's called as the area proxima. Area proxima. What is area proxima? It is a circumventriculate organ. It is a circumventriculate organ. Circumventriculate organs are those organs which does not have a blood-brain barrier. These does not have blood-brain barrier. Clearly, so floor of the fourth ventricle is clear. How floor of the fourth ventricle? First, we will draw a diagram. Then we will name the different structures. For that, do refer to video 1 of this playlist. Then we will describe certain structures: dorsal median sulcus, sulcus limitans, facial colliculus right here, then locus ceruleus, then area proxima. Area proxima is a circumventriculate organ because it does not have a blood-brain barrier. Clearly, so the floor of the fourth ventricle is clear. Now we will talk about the lateral boundaries of the fourth ventricle. Lateral boundaries. Inferior laterally. Now the third heading is lateral boundaries. Now our third heading is lateral boundaries. Lateral boundaries. Inferior laterally. Inferior laterally. Inferior laterally. In the floor of the fourth ventricle, we do know three structures. Those are gracile tubercle, unitubercle, and inferior cerebellar peduncle. Clearly, so inferior laterally, three structures are present: gracile tubercle, unitubercle, and inferior cerebellar peduncle. Clearly, similarly, superior laterally is another structure that's called as superior cerebellar peduncle. Clearly, so the lateral boundaries of the fourth ventricle are clear. Now we will talk about the roof of the fourth ventricle. Roof of the fourth ventricle. For that, how to draw the roof of the fourth ventricle, refer to the video second from this playlist, and the diagram is this. And the diagram is this. This is the roof of the fourth ventricle. In the roof of the fourth ventricle, we can say that the roof of the fourth ventricle, it is diamond shaped. So this roof is diamond shaped. Diamond shaped. Clearly, there are three important structures that we note here. This area right here is a lateral recess and a lateral aperture. So this right here is a lateral aperture. Here is another aperture, 1 and 2. Two lateral aperture and one aperture right here, that's called as the median aperture. Clearly, so in the roof of the fourth ventricle, we have a lateral aperture, another lateral aperture, and one median aperture. Clearly, so roof is clear, because in the roof you will just draw the diagram, this label diagram. You will just draw the label diagram of the roof of the fourth ventricle, and you will find how to draw this diagram in the video second of this playlist. Clearly, after drawing the roof of the playlist, after drawing the roof of the fourth ventricle, clearly, so the our fourth heading is roof of fourth ventricle. Roof of fourth ventricle. Clear? Now after that, we will talk about the communications. We will talk about communications. Clearly, communications. This fourth ventricle communicates superiorly, clearly, to the third ventricle. Or we can say that third ventricle communicates with the fourth ventricle through cerebral aqueduct of Sylvius. And this fourth ventricle communicates with central canal of spinal cord. Clearly, so third ventricle communicates with the fourth ventricle through cerebral aqueduct of Sylvius, and fourth ventricle communicates with the central canal of spinal cord. Clearly, this fourth ventricle also communicates via through three apertures. Clearly, we know in the roof of the fourth ventricle we had two lateral apertures and one median aperture. Clearly, these two lateral apertures are called as the foramen of Luschka, and this median aperture is called as the foramen of Magendie. Clearly, so fourth ventricle also communicates via two lateral apertures and one median apertures. This is the roof of the fourth ventricle. This is the lateral aperture. This is the lateral aperture. This is the median aperture. Clearly, what are these apertures for? These are for CSF circulation. CSF from the third ventricle goes to the fourth ventricle by cerebral aqueduct of Sylvius. Then CSF from the fourth ventricle goes to the central canal of spinal cord. It also goes by two lateral apertures and one median aperture. These two lateral apertures are called two foramen of Luschka and one foramen of Magendie. So CSF from the foramen of Luschka goes to the cerebellopontine cistern, clearly, and from the foramen of Magendie, from the median aperture, CSF goes to the cisterna magna. So CSF from the lateral aperture, two lateral apertures, goes to the cerebellopontine cistern, and CSF from the median aperture goes to the cisterna magna. What is this cisterna magna and cerebellopontine cistern? These are subarachnoid spaces. Subarachnoid spaces. Clearly, so communications of the fourth ventricle are clear. So what are the communications? What we study in communications? Third ventricle communicates with the fourth ventricle through cerebral aqueduct of Sylvius. CSF from the third ventricle goes to the fourth ventricle through cerebral aqueduct of Sylvius. CSF from the fourth ventricle goes to the central canal of spinal cord. It also goes through two lateral apertures and one median aperture. This two lateral apertures, these are two lateral foramen of Luschka, and this median aperture is foramen of Magendie. So CSF from the foramen of from the lateral aperture or foramen of Luschka goes to the cerebellopontine cistern, and CSF from the median aperture or foramen of Magendie goes to the cisterna magna. What is the cisterna magna and cerebellopontine cistern? These are subarachnoid spaces. Clear? So the communications of the fourth ventricle are clear. Now we will talk about the cavity with recesses and angles. Cavity with recesses and angles. Recesses, angles, clearly. So for this heading, we will draw a diagram. We will draw a simple diagram like this, clearly, in this way. First bulge, then second big bulge, then third bulge, then we'll continue it like this, and another circle here, and this will continue like this, and here we'll make a circle like this, and we'll join it like this. Clearly, it goes like this. Actually, this line is cancelled. Clearly, so this bulge right here is called as the median dorsal recess. Clearly, this bulge right here is called as the lateral dorsal recess. So this is another lateral dorsal recess. Clearly, what is this circle? This is the lateral aperture and lateral recess. Similarly, this is the lateral aperture and lateral recess and this bulge right here is the median aperture. This line is like this. Clearly, is it clear? So from this diagram, it is clear we have one median aperture and one lateral aperture here and another lateral aperture here. So total of three apertures, two lateral apertures and one median aperture. Similarly, we have five recesses. We have the medial dorsal recess, lateral dorsal recess, one lateral dorsal recess, another lateral dorsal recess, and another lateral recess here. One lateral recess, one recess, second, third, fourth, and five. We have three apertures and five recesses. Clearly, these five recesses. What is a recess? Recess is an extension of cavity. We are talking about the fourth ventricle. So here we have the recesses of the fourth ventricle. Clearly, what are these recesses for? These are to accommodate CSF. These accommodate CSF and help in CSF circulation. These three apertures, these help in these come under the heading of communications. Clearly, these come under the heading of communications. Clear? Now we have here the last topic of the fourth ventricle, that is its clinical anatomy. So we completed introduction, we completed lateral boundaries, we completed floor, we completed roof, we completed communications, we completed cavity with recess angles. Now we have the clinical anatomy of the fourth ventricle. Clinical anatomy. So we have here clinical anatomy. Clinical anatomy. Every book gives clinical anatomy points, so you can refer to different books for different clinical anatomy points. So my favorite first clinical anatomy point of the fourth ventricle is Dandy-Walker syndrome. Dandy-Walker syndrome. Dandy-Walker syndrome. Clearly. So what is Dandy-Walker syndrome? Clearly, Dandy-Walker syndrome. What is Dandy-Walker syndrome? In this syndrome, there is atresia. There is atresia. Atresia of foramen magendi and foramen luschka. Clearly, two foramen luschkas. We have one foramen magendi and two foramen luschkas, one median aperture and two lateral apertures. Clearly, in Dandy-Walker syndrome, there is the atresia of foramen magendi and two foramen of luschkas. Clearly, number second clinical point. So this is the roof of the fourth ventricle. Roof of the fourth ventricle. This is the lateral aperture, and one median aperture. Whenever there is atresia of these three things, that's called as Dandy-Walker syndrome. Clearly, number second point, we know the diagram of the floor of the fourth ventricle. This is the diagram of the floor of the fourth ventricle. Clearly, this area right here is vagal trigone. This area right here is vagal trigone. Clearly, so vital centers, these are present in the vicinity of vagal trigone. In the vicinity of vagal trigone. Therefore, any injury would prove fatal. Clearly, so any injury would prove fatal in fourth ventricle because vital centers are present in the vicinity of vagal trigone. Clearly, number third clinical point and the last clinical point of the fourth ventricle. This foramen magendi and foramen luschka. This foramen magendi and foramen luschka. These we have two foramen of luschkas. So if ever there is a blockage of these foramens, if ever there is a blockage of these apertures, clearly it will result in their blockage. Their blockage will result in headaches, vomiting, and papilloedema. Clearly, so these are the three clinical points about the fourth ventricle. Clearly, so how can this blockage occur? These blockage can occur because of the brain tumors, infratentorial brain tumors. Clearly, so this is all about the fourth ventricle. How to write this answer in the university examinations? We have 7 headings. What are these 7 headings? Introduction, then floor, then lateral boundaries, then roof, then communications, then cavity with recess and angles, then its clinical anatomy. Clearly, I hope these 7 headings make a good answer to the question of the fourth ventricle. Thank you very much, your Dr. Oogway.